Hello and welcome to today's webinar, Transforming the Appeals and Grievance Process for Member and Provider Satisfaction. Before we get started, I'd like to review a few brief housekeeping details. Today's webinar is being recorded and an online archive of today's event will be available a few days after the session. I'd like to remind you of AHIP's antitrust statement and ask that you reference it in the Handouts tab. The antitrust statement prohibits us from discussing competitively sensitive information. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right-hand side of your screen and press enter. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen. We're very fortunate to have with us today Mr. Vadiraj Guttal. Vadi is an IT executive with more than 21 years of IT experience and more than 14 years of healthcare payer consulting experience, focusing on implementation and system integration of core administration platforms. In his current role as Head of Products, Platforms, and Solutions, he is focusing on developing products and solutions leveraging digital, AI, and RPA to improve payer operations, as well as optimizing medical costs through AI-augmented care management. And at this time, I would like to turn the floor over to our speaker.
Thank you, Crystal. Thank you all for being here today. It's a Friday afternoon, and I know you're better off doing something else than listening on healthcare appeals and grievances process. It means a lot to us that you have taken time out to come and join us on this webinar. We hope to make it an interesting presentation. Research shows the coefficient of correlation between customer loyalty and experience in handling their disputes is very high. In fact, the dispute process is often overlooked as a chance to build trust with their customers. Financial industry, specifically banks, went through this transformation process over the last few years in digitizing the entire dispute handling process, and while reducing the operating expenses by 40%, and able to resolve the dispute in minutes that used to take days and weeks. The key traits in handling disputes, it's highly personalized, needs to be simple to comprehend, lead them to make specific to the product or the services they have rendered, and most importantly, it needs to be easy to use. If you look at the most customer-obsessed enterprises around today, they have these in place to help their customers raise their appeal or a grievance about the product or service. To file an appeal, a member has to review the summary of benefits, inclusions and exclusions from the, in terms of the coverage, understand their claim denial reasons, talk to physician, collect the necessary documentation, understand health plans appeal process, fill up the appeals form. It's a lot for the member to go through and appeal on for a denied claim, as an example. In some cases, you are also advised to take an external help to fill out these forms, to make you an effective appeal. On the other hand, peers will have to accept the documentation, review the documentation, refer to their internal guidelines and materials, obtain additional documentation from the provider as deemed necessary. To summarize, I think there is a lot of documentation and paperwork involved in the healthcare appeals process. While when payers mess up the documentation or any causes that delay in the process, they end up paying fines, and the quantum of these fines are pretty significant. That matters in terms of their administrative expenses towards their MLR. This is an interesting perspective. If you look at 32% of the appeals were related to coverage or benefit, and 38% of the appeals had significant financial consequences for either member or provider, or both of them in certain cases. On an average, it costs about $118 for a provider to work with a member to file an appeal and help the member to file an appeal. So if you look at just the Obamacare marketplace as a line of business, and due to the transparency initiative, that data is available to all of us. And if you look at it, there are about 16% of the claims received were denied last year. Out of those 16% claims that were denied, 10% of the denials were due to either coverage or medical necessity reasons. Here is the interesting fact. Less than 1% of those denied claims were appealed. Now, that tells us, how onerous this process is, and how members who are the consumers of these services are hesitating to go through an appeal process because of the time and the documentation it takes, and also the expenses associated with raising an appeal. Now, on the other hand, from the customer service perspective, there is a significant weightage in the star rating for appeals and grievances from the Medicare plans perspective. So there is significant administrative wastage, and there is an opportunity to improve the A&G process in order to reduce the burden on the health plans, while improving the experience for both member and providers.
At this point in time, we would like to do a polling. Thank you for your responses.
So I'm Vadiraj Guttal. I head the healthcare products, platforms, and solutions for Infosys. I have with me co-presenting Smruti Snigdha. She's the product manager for our strategic products in the marketplace. And I have Anuj Parashar. He is the industry principal and leads the product development for some of the products we are working on. Now, I would like to invite Smruti to get us through the details of how do we go about improving the experience.
Thank you, Vadi. Hello, everyone. At Infosys, our product design uses design thinking approach. Let's look at this persona of a member, John William, who is a 75-year retired individual who has a history of arthritis. He has been using oxycodone for severe pain management, but his recent claim with his new plan was denied as a possible abuse. When he approached his physician to file for an appeal, his physician raised an appeal but did not know the documents that needs to be submitted, and ended up missing the documents that has to be submitted. This led the appeal getting denied and led to another reappeal. This time around, his physician submitted the outcomes of the alternate drug treatment plans failing, but did not submit the medical records, leading to yet another denial. In the third attempt to reappeal, the physician submitted all the needed documents that led to the appeal being approved. Now let's take a look at John's emotions through the process. It goes from being hopeful that somebody is looking at the case to being frustrated to actually losing trust, not just on his doctor, but on the health plan as well. This was the first interaction that he is having with the new plan, and the experience let him doubt the plan's intent to play. His worry was not just about this claim being denied, but he was more worried how he is going to take care of his future health needs. This can be any person's worst nightmare. Imagine the emotional stress that John went through and the mental pain as an individual goes through, and the perseverance needed to get through the process. In today's digital social world, this doesn't just stop with the member talking to his or her relatives, but ends up as a post in a social media. One other thing to note here is the time taken. This was a case of a standard appeal, and with 3 appeals or reappeals to get to a favorable decision. During these 3 months, John did not have any insights to the progress made on his case on the payer side, and the only way to know about the current status was to call the health plan. He felt, absolutely helpless, and as this was the only option that was available for him to talk to the health plan and get a status on it. What we have observed is that in case of medical necessity, appeals are sometimes raised 3, 4, 5 times, and many a times end up being an independent medical review. As cases go through multiple appeals, the time taken keeps increasing. But when we look at it from a member perspective, the suffering on the condition continues. So this leads to additional treatment cost for the health plan as well at the end. When we
We'll do a quick poll for the member experience. Are you willing to change your ENG process to improve member experience? And you can continue, Smruti, along the way.
Sure, thanks. So when we look at the forms, that are required to be submitted, and the documentation needs especially, there are, it says attach copies of any records you wish to submit, and my favorite, include all supporting documentation. I would not know at this point in time what needs to be submitted, and this is, when you are submitting a form, there is no clarity regarding documentation required at the time of submission, leading to multiple follow-ups to get the right documentation, which adds to the delay in the whole process. The way our human memory works is that we remember peak experiences, and we only register best and the worst experience. So in this situation, it registered for John that the health plan is not trustworthy. it registered that they do not intend to pay, even though the health plan's decision at the end of the review process, the decision was in John's favor. He wished he continued on with his earlier plan and made up his mind to switch as soon as the open enrollment begins. So instances like this typically trigger member attrition that the health plans see. And there is a lot of administrative cost that is also spent to retain members. But the retention is, and the main cause for attrition is the experience or the dissatisfaction that they see through these processes.
We'll do a quick poll on the provider experience. Are you willing to change your ANG process to improve provider experience? While the poll goes on, Smruti, you can.
So this is another member scenario that I want to walk you through. So we have here Keith Thomas, who has a type 2 diabetes and was admitted to hospital for treatment of high lactic acid. He stayed for 10 days, of which 7 days were paid for by the health plan, and the last 3 days of stay were denied. He was utterly confused because his coverage stated that hospital stay is covered in case of acute and emergency situation, and he confirmed it with his provider before getting admitted to the hospital. He was not happy with the outcome and filed for an appeal. Now, looking at the emotions of what Keith went through in the whole process, it's very similar, to what we saw earlier. Frustration with the process, the requirement to follow up to get a status, worried of the outcome, that if the decision is not favorable, he has to pay a lot out of his pocket and felt helpless when the decision was made. The health plan in this scenario went through multiple reviews internally and externally, making sure that there was an absolute due diligence that was performed before making of the decision. And they have found that the last 3 days were, not an acute or an emergency situation. His blood sugar and acid levels were normal. His heart rate was normal, and he was eating fine the last 4 days of the discharge. But then, as time elapses, member feels he should have researched, better and not left the decision to stay in the hospital with the provider and blames himself. So these are the emotions that are, coming up with the member as he is waiting for those decisions to come in. The policy details, are hidden between words. It is absolutely difficult for members to understand when, where, and how they need to use their benefits. When it comes to situations like this, when a person is actually admitted to a hospital or in a hospital, we do not expect them to pull up benefit details on a hospital bed and look at it. Summarizing the member experience needs. So we looked at, lot more cases before we could come up, and summarize what are the experience needs. The experience needs that from a member perspective is the ability to raise a dispute without having to download and, filling forms, and then having to, fax or mail them. So what we are looking for is truly a guided appeal submission and ease of submission, clear understanding on the documentation needed to file an appeal, real-time form validations for completeness, ability to verify status and transparency into the review process. That is, status being viewable on the member portal or the member app, access to information, which is easy to understand the coverage policies, the limitations in those policies, medical necessity requirements. So the solution here is to provide as much of self-service and intuitive self-service, which is guided through analytics, access to outcomes on similar cases, because they are not left alone. The feeling is not that I am the only one who is going through this. Prediction, personalized videos, and educational materials can help member get over that experience. So as we look at the published polls, I think 86% have said that they would like to improve provider experience. So let's take a look at what the provider goes through in the process. So here is a persona of James White, who works in the back office of a provider group. A number of claims have been denied for their practice. And for various reasons, like third-party liability, balance billing, quantity update, etc. James wants to file for an appeal for each case, but only 3 fields are editable per claim, and he can only submit for 15 claims per submission. He submits the details in the spreadsheet to the plans, only to realize that the plans create 1 case per claim and routes them to different departments based on the denial reasons. So now tracking becomes difficult for him. So first thing, he receives multiple acknowledgement letter, for each of the case, and now has to track it back to his tracker or his spreadsheet. He feels irritated, as that he has to track and all the acknowledgement forms, even though he was asked to collate and submit all of them. To add to the pain, not all acknowledgements come in at the same time. He needs to open up his tracker, and as he gets notified of these acknowledgements. James is being requested to submit additional documents for few of the claims, which again comes in at a different point in time. It doesn't come in or make it easier for James to consolidate and on one of the appeals. Again, after the required documentations have been submitted, it becomes a black box for James. He has to follow up multiple times with the plan and get a status, and on each case. It is not consolidated, which adds to the, amount and effort of time he has to put in order to take care of appealing for these scenarios. The process is highly labor intensive, and James feels irritated, exhausted with the cumbersome process. It can be overwhelming, when we have new administrative folks joining and taking this over. To think of it, each health plan has a slightly different way to handle bulk claims or bulk appeals. And James has to remember what needs to be done differently for each and every plan, and learns, based on his experience working with the plans, as there is no documentation of what needs to be done. Another typical scenario that we often encounter is around denial of payment, as member was not enrolled on the date of service. So this is a process issue, because of the latency that has been built in getting or sharing eligibility information from state to health plans to providers, and what we go through in the process within the payer organizations. So here, Dr. Henry, who is an endocrinologist, he provided service to his member, James Smith, who is a Medicaid member. Dr. Henry's office had verified eligibility at the time of service, but due to retro member termination, James Smith lost his medical coverage, and claim was submitted after 45 days of the service and ended up being denied with no coverage. Dr. Henry files for an administrative appeal, and after a detailed review of the appeal, the health plan identified that the retroactive coverage change and the appeal was overturned. Dr. Henry realizes there is a lot of paperwork and proofs required to be submitted, like the provider contact details, member eligibility report at the time of service, proof as shown on eligibility verification or via IVR, any communication that made that, and that too when the service was provided. So which is, approximately 2 to 3 months back when the service was provided, and all of these recorded information are required to be submitted in case of an appeal. He's required to provide operative notes, necessary medical information along with the information that is available. So there are certain information that is already available with the health plans that he is also required to provide, like evidence that the service was provided, claim details, procedures being appealed, the charge amount, etc. So he just delays filing for it because he has to collate or consolidate all of these required information. Dr. Henry is thinking, if claim has already been processed once in the payer system, isn't this an evidence that the service was provided? Why is he being requested to submit information that the plan already has? So post-review, even though the decision is in favor of Dr. Henry and he gets paid for the services, the entire interaction has actually left him annoyed as these cases keep repeating. Summarizing the provider experiences, similar to, what we saw on the member side, the ease of submission, clear documentation needs, ability to holistically view the claim denial reasons. So insights-driven comparative reporting on denials and reimbursements to be shared upfront at the time of submission itself. It can all be digital. You can look at, how these claims are going to be processed or reprocessed in the payer system after they are submitted or an appeal is submitted. Access to information, understanding of the policy limitations, medical necessity, each one of those, including, clinical guidelines if needed, and visibility into the process. So this, we definitely is one of the areas that both payers and providers have to call in order to get this information that can be changed. So we talked about members and providers. Now let's take a look at, and it is not easy on the payer side of it, when it comes to managing the appeals process. So here we have Kimberly, who is an A&G coordinator and has missed addressing appeals within the defined SLAs. So she is already under a lot of stress, to make sure that she doesn't that she meets all the guidelines and the SLAs. She is reviewing the case of Keith and is trying to find out or identify why the case, is not closed. So Kimberly looks at the process, she's looking for information and she wants to get a holistic view of what has happened in the past. If it is a retrial or a reappeal, where can I get all of this information? And there is no way that all of this information today is available for her in the system that she is using. So she goes through, requesting department after department to share the information, collating that information, creating a case, and sending it for clinical review. Post-clinical review, she has to go through the process, send it for a MD review or a director review before she can close the case. So whatever her decisions are, it has to be reviewed. She has to, the burden of ensuring that there is a due diligence that is performed while she's reviewing a case is on Kimberly. While she's already stressed out, with the processes and the, nature of requesting multiple follow-ups on the case to get information, she also has to ensure that there is a proper review that happens in the case. So, summarizing, what Kimberly would be requesting, or what her experience needs are. She needs to have the ability to prioritize work. There should be no slipped SLAs. So, intelligent, smart dashboard with alert features that can help her manage her work better. She's looking for ease to manage acknowledgements and correspondences, which is automate letter template selection with pre-populated text that she can just send out, on click. She is looking for review of completeness of the form, a real-time validation for completeness, so that she's not missing out, requesting information and denying an appeal just based on missed documentation. Access to outcomes of similar cases in the past. This would be a big help to Kimberly, because she has today, she wouldn't know how such similar cases were dealt with in the past. So insights from historical appeals, analysis, or including medical policy coverage, all of these would help Kimberly, to better assess the case that she is working on. All medical, clinical, and historical information available in one view. So primarily a 360 view of the appeal, and ease to track workflow changes. So intelligent routing, transparency to status, and information through the review process. This is what she would be looking for in a transformed scenario. We have simulated these member, provider, and coordinator experiences, and now I'll hand it over to Anuj on how these journeys will be realized. Anuj, over to you.
Thank you. I just want to check before I start. I'm paused on the video. If Smruti, if you can confirm you're seeing the paused video right now.
Yes.
Okay. Hi everyone, and I will be playing this video and pausing in between, so bear with me to see the actual application or the member journey and the journey on the plan side as well. So what we have here is, just to summarize, so this is a view that the member will see, or the experience that the member will get. Keith Thomas. So Keith Thomas is 57 years of age, has high diabetes, and had a symptom of high acidity in his acid levels in his blood. So he was hospitalized for about 10 days, but his claim was denied for the last 3 days, considering it was medically unnecessary. So he wants to, so his stress level is high because the amount is, significant, 30,000, and he wants to, so going back to what Vadi and Smruti have stressed upon is the ease of access of submission of an appeal. So what we'll see here is Keith is logging into his mobile app. We've created a view to his mobile app for the health plan, where he is able to, so the view itself, if you've noticed, was more of, I'll start again, sorry. So the view itself is what we are taking from the concept of, how consumers today see as apps like Uber and all of that, where the ease of navigation and ease of submission is there, right? And it's through a powerful digital platform. That's exactly the experience we are trying to bring here. So he selects that, he wants to look at all the claims that he had submitted. He sees that from the list that, the honor health claim, which is for the hospital submission, was in denied state. Instead of calling the health plan, ABC Health, he wants to quickly file an appeal right there. And what you will see is he gets to the details of the claim itself. 35,000 was it the total charge amount, how much the insurance has paid, how much liability he has. So as you can see, 5,000 is what he has to pay, and that's what he's appealing for. I'll move along, and right there itself, the guided submission occurs. So what that means is he can quickly enter the appeal text, like why does he think that he needs to get paid for the entire 10 days. Along with that, what you will see now is that as soon as he does that, the system proactively brings out, because we already know that he's filing a claim and the history behind it. The reason was for an hospital stay wherein the last 3 days were medically unnecessary. So the system is prompting him or guiding him to submit documents that will help him, might help him get the appeal overturned. So that's what is exactly happening. So it prompts him, have you attached the clinical results for entire 10 days? Have you attached, the hospital release note report, and also the prescription from Dr. Erin. This is a powerful digital AI/ML platform that we are using, so called Pega. And what you can see is the ease of submission of the appeal itself, right from views to attaching documents and sending data across, the actors themselves. So here you can see that the documents were attached. He clicks on submit. But before I do, I would like to highlight also a key aspect of this platform. If you notice down below, what we are also giving is insight, analytics-based insight of similar appeals, wherein 80% of the appeals, in similar stays were denied in the past for other members, similar nature, similar services that were given. So through that, what we intend to say is that maybe looking at this, he understands, okay, I have a, he gets to know possibly the outcome could be. So his stress levels might come down, but essentially, if you think of this, this is a member experience. So we want to have this similar experience for on the provider side as well. So that's why we think that, these kind of insights will help that perception come into play. The other thing would be, we already know, and through the data that Vadi and Smruti spoke about, is on reducing the operational cost. So the lesser number of appeals filed, the lesser the cost on the plan side. So I'll move along. So here again, he submits the appeal. And the next view that you will see is John Smith. He's the A&G coordinator on the on ABC Health side. When he logs in, and he would land, his landing page would be a dashboard of this nature, wherein he can get views in terms of appeals in his work list, his groups, work queues, which are in different stages, and then also highlighting the part where the list itself that you see down below is based on SLAs. So what that means is anything urgent, anything that any appeal that is closer to the deadline and thereby about to be missed for on the deadline, and the plan will have to make payments on that. So that's the view they will get. Now this is the So John selected the appeal that Keith submitted, and what he gets to is a appeal 360-degree view, if I may call that. And John is able to view, all the data in terms of the member demographic, the appeal information itself that Keith submitted, and also for his research, right? All data that ANG coordinators need or medical reviewers need in terms of researching the case is all there. They don't have to swivel to different systems and all of that. So what you see here is he's able to look at the claim data itself. He's able to look at the coverage details, obviously. And what you also will notice here is this is the part of the transparency into this whole process for the members. So what we are giving them is constant status updates, communication to the member, Keith, in this time, saying we have received your appeal, we are processing it, and we'll get back to you. And along with that, and I'll spend a little bit of more time here on the value adds and where we think the analytics and insight that this platform provides that can either do two things. One is make the experience more personalized. Second of all, improve operational efficiencies on the plan side, either in reducing the cost and thereby reducing the fines that they have to make for appeals and grievances. So what we see first is a view to the emotional index for Keith, which is fairly high. Now, what we feel is this emotional index is basically built on applying some NLP and deep learning models on the appeal submission notes that Keith submitted. We also know, because he's a member of ABC Health Plan, so we know his financial and health condition from already. We also have his prior call notes, right? In prior interactions and similar or claims that he has submitted in the past. We have that information. So, and also related to this appeal, we know for a fact this is a repeated, this is a second time that he's appealing, and the amount is also right there. So we built some NLP and deep learning models that we are able to calculate a score called emotional index. Basically, what it highlights is its emotional stress level. Now, how this will help John, who's the ANG coordinator, is if he sees that it is high, which is in this case, the outreach to Keith will be accordingly, meaning whether he feels that he needs to give Keith a call and explain to him what they're seeing and how likely the outcome is going to be, or leave it to the system to communicate through emails or through mail, as happens today. So that's the highlight on emotional index. Now, coming to this section on the right, if you notice, is the four sections. So decision. So what we felt was, now again, this is going into the lines of helping the plan actors, ANG coordinators, medical reviewers, MD reviews, on insights that can reduce the turnaround time for the entire process, and also make them decisions faster, and thereby improving the operational efficiency, and also being able to outreach in a better way to the member or the provider. Now, first thing that you see is the decision, the system recommendation. So what we are saying is, proactively, the system has built it, and it's built on a predictive model that uses Keith's clinical data, that uses Keith's coverage and eligibility data, and blended with appeals of similar nature, meaning appeals that were on similar type of service setting with hospital stay, and also the diagnosis, right? So build a model, a predictive model that the system can say that, okay, it looks like, based on all of this data, the system feels that it will be upheld. So that's what it's saying. The final decision is what obviously the medical reviewer, the nurse, or the medical director will take based on their manual analysis. Similar cases, as I said, brings about the fact that to improve operational efficiency. So what it's telling John is, hey, along with Keith, you have 3 other cases which are of similar nature. So the outcome is likely going to be same. I'm not saying it will be same, but it's likely to be same. So thereby he can, adjust his inventory that way. Third thing is the recommendation. So what here we have built is an automated bot that runs behind the scene, and checks for whether this appeal met the plan coverage, whether it met all the medical policies, clinical guidelines, and whether similar cases, did the outcome was similar. So that view is provided to the ANG coordinator, John, here. But you will see the other actors also have the same view. The last but not the least is the next best action. Now, this is a predictive model again, suggesting the actor at that point of time, what is the next step that he or she can take. So John can take based on similar cases, the recommendation outcomes that you see, what does the system feel he could do. So here, and obviously it says send for medical review, but that's what the essence of next best action is. Move along. So John is able to view all of this, make his judgment, do his research accordingly, and now he will submit the appeal for the medical reviewer, who's Clara. Clara is the medical reviewer, to send her to do the research and get her decision from her in terms of whether to overturn the appeal or upheld. So what you will see is Clara, a view to how Clara would see the appeal in her dashboard. It's going to be very similar, essentially covering the similar aspects, right? Being able to track appeals on the go basis, giving intuitive insights to all the actors. So similar view that Clara has in terms of reviewing the case. But what you will additionally see is the clinical notes. So all the entire history of clinical notes is right there for Clara to be able to view them, make a judgment call accordingly, thereby expediting the process. So essentially what we are trying to do is reduce the research time as much as possible for the different actors to reduce the end-to-end process time. So Clara reviews the clinical notes, and then again, if you'll notice that the next best action based on the current stage where they are in the data, it says that the system says send for MD review also. So you can take your decision, but send it for MD review. So she selects the right reason, medically unnecessary, and submits it. Now, because the system was able to prompt her to send it to MD review, that's what she does. And what you also notice is what we spoke about is constant communication and transparency into the whole process for the member or provider. So here is an example of how the system is able to, instantly communicate to or notify the member, Keith, that is the first step. At first step, it is denied. Clara opts for an MD review, and what we'll see is how, or what essentially Mason is the MD in our case. So Mason would log in, and as you will see, it is a similar view that Mason also sees in terms of, but what he sees is his work queue, obviously, and picks up the appeal 190, which was submitted by Clara, looks at the claim details, similar view. I won't spend too much time here, but again, looks at the clinical notes. So whatever Clara was able to add in terms of the medical and clinical review. And he wants to keep the decision as denied, so upheld. So the decision is upheld. But now what additionally we felt was, if you notice that here, a lot of cases we have seen that, an independent review, cases of such claims being denied of hospital overstays required an independent review. So that's what Mason is doing. He's routing it to an IRE, independent reviewer. And the IRE, for the demo purpose, we kept the view same, is able to look at all the notes, all the comments, all the research comments from the medical reviewer and the MD as well, and takes a final decision. So if you noticed, now once the IRE submits that, yes, he wants to uphold the decision, the system, if you look at it, the system recommendation was upheld, that the predictive decision that we provided earlier, and the final decision became upheld as well. So at the end, obviously, as I said, once the IRE is able to make that decision, what we have is in the platform is the communication to the member. Now, what will happen here is, looking at the emotional index, the medical director will make it, or the nurse will decide whether to call the member and explain to them, or let the system handle the communication.
At this point in time, we would like to take a quick poll, and we'll hand it over to Vadi while you take the poll.
Yeah. Thanks, Anuj. I think, if we looked at the Anuj's illustration of how the experience can be for both the member as well as the health plan administrator to, finish through the appeal process, that our transformation approach is based on leveraging the advancements made in the digital technologies. We want our members, providers, and health plan administrators to have best of the possible experience in as back office function as it gets like appeals and grievances. We believe this experience could be built up through one, insights based on data that's already out there with the respective participants. Second, make it accessible to all the constituents participating in the process in a transparent way. Third is the engaged in a meaningful way to reduce the stress and the anxiety through the constant and real-time communication. And lastly, making it very efficient through use of robotic automation of the manual interventions. And when you look at the broad set of IT capabilities and that are required to see through this transformation, we put to use the latest digital techniques and the technologies available to improve the functional experience, thereby leading to significant business outcomes. For example, Anuj showed about the emotional stress index. That's the employing deep learning algorithm to do sentiment analysis and express it as a member emotional index. Another good example I think we saw in the demo was use of advanced data science techniques in building up the prediction of outcome of an appeal. And lastly, using these insights and the machine learning based algorithms to guide the member or provider during the submission of an appeal. In the process, the members and providers are going to have a very good experience, as well as helps the health plans comply with their state and federal regulatory obligations, as well as optimize their administrative expense on this. Now, if we were to go back and look at John's experience and how this was and how it's going to be with the experience like what we just saw in the illustration, right after, the claim was denied and every step through, he has been engaged. He has a pleasant experience of through the process. Now, it doesn't mean that his appeal could be overturned or it may be upheld because he could prove his point. But he was engaged, his experience was good, and he was happy. So the participants in the appeals process, be it member or doctor or the health plan coordinator working on the case file, are happy and had a good experience, and that is, I think, is the most important aspect of the transformation. And of course, in the process, if we can optimize and bring down the administrative load on the health plan administrators, and typical resolution that takes on a very standard cases of 15 to 18 days today, if we can bring it down to less than 3 days, that's a significant cost savings for the health plans. So I think that's all we had for today to share.
But we do have a few questions here. I know few minutes left, so we'll try to pick up a few questions and request Fadi to take these up. One of these questions is around submission of documentations or a request to submit any supporting documentation. Question is, what would you suggest the health plans state to request documentation? ANGs are very case specific, and the insurance carrier will need any documentation to support the medical necessity of a service. Please advise on your recommendation.
Yeah, I think a very good question, and I thought some of the aspects of this Anuj illustrated through in his demo. How do we based on the knowledge model that the system has, it will prompt the user the necessary documentation that is required from the whoever is filing the appeal. It could be provider or a member. So the necessary documentation that is missing in a case file will be prompted. So that's one. And I think the second one, these documentation or the ask for the documentation will be highly case specific. It's not a generalist, I want this, I want that. It is based on the type of the appeal and the documentation needed for that appeal. It's a highly workflow driven, as well as the business rules embedded, and it refers to the historical past cases of similar nature, and then prompts these questions. So it's automated and intuitive for the member or provider to fulfill the documentation requirements.
Fadi, we might just have a minute to take one question.
Sure.
What are the areas that robotic process automation is being used?
So in the illustration that I think we saw, the data collection from the different sources, collating that together and putting it in a consumable way for the health plan coordinator or the medical director for his review. I think that's all automated through a robotic process.
And also the recommendation section that I showcased, wherein the research behind the scene is happening on whether it met the medical policy, clinical guidelines. So that is also automated for research.
Yeah, that's correct. Thanks, Anuj. So I think we are top of the hour. Crystal, back to you.
Very much. Thank you very much. So to our speakers, thank you for that great presentation and for sharing your thoughts. Thank you also to the audience for participating in today's webinar. This concludes today's presentation. Thank you again and enjoy the rest of your day.